Governor, as you heard here today, that we benefited from CARES Act funding that allowed us to buy telephones, iPads, laptops that we put in the hands of the people that we serve in order to help them transition to telehealth. In addition, we've just recently been awarded new CARES Act funding that will allow us to do just what you said, go out into the communities, into our most urban areas with a mobile behavioral health clinic that will be fully equipped with video telephonic equipment, so that we'll be able to virtually connect people with direct behavioral health and physical health care and get people their medication. But when you talked about who am I forgetting, I think it's important that we don't forget that our employees, our 343 employees, are healthcare workers. They're essential workers, and they have been on the front line even in the height of the pandemic. If other than today, this will be a staging ground for mobile community-based services. There will be food everywhere. And so in the height of the pandemic, when a lot of people were quarantining, we had people that were on the front line. And for our frontline employees, the average person probably makes between $35,000 and $40,000 a year. So when you talk about transitioning to telehealth and more technology-based care, we learned through this process that all of our employees do not have a computer or a mobile computer-based device that they can use independently and solely for work. Nor do they have the appropriate level of Wi-Fi to be able to use that at work. And as an employer and a nonprofit, we did not have enough mobile devices to give to our employees. So it's, our employees that are on the front line, that are juggling critical care and their own family needs, we're not able to provide them with every single person with a mobile laptop or device that they can use independently for work. And that is something that we desperately want to change. That is the next phase, to make sure 100% of our employees, all 343, have a laptop that they can use, that they have Wi-Fi, and that we're giving them 100% of the tools that they need to be successful every day. And we have applied for additional funding through the Nonprofit Relief Fund from the state, and we hope that is successful. But that's our additional challenge. We want to make sure that we have the equipment and that we can do all of the proper training with our employees and with our persons served, so that they can be as successful as they can and they don't feel that we've forgotten them, that we push them to continue to provide care and not giving them all the tools that they need to be successful.